I think we are live. Hello and welcome everyone to today's FRCR webinar. In the next 1 hour, what we're going to do is try to solve a lot of queries that most of you have about the FRCR exam. In the first 40 minutes, it's going to be a didactic talk. We're going to go over the steps. What are the different steps? What are the criteria for each step? And what are the useful resources? While you're attending this, feel free to ask your questions in the chat section. And then we'll answer all the questions at the end of the session for around 20 minutes. So that way, I hope we'll be able to cover all your queries. And the speaker for today is Dr. Ameya Kawthalkar. He is a very enthusiastic teacher and a very good friend of mine. He's completed his MD, DNB, and both his FRCR exams and EDIR. Along with that, he has done a fellowship at Netherlands, and currently he's working as a consultant musculoskeletal radiologist in Nivaran Excellence in Mumbai. So without wasting any further time, I'll hand it over to Ameya. And just to, if there are any issues with the audio, you can type in the chat section and we'll try to sort them out. And as always, if you want to be notified about all future videos, make sure you hit the subscribe button. Over to Ameya.
Thank you, Amar sir, and a very good morning to everyone who has joined us today on a Sunday morning. And a big credit to Amar sir because he's doing a fellowship in Canada in abdominal radiology, and it's 11:30 right now, I guess there at night. So it's Saturday night there, and by the time we finish, it will be way past midnight. So a big credit to him. He's very passionate about radiology and regarding academics, and hats off to him for organizing this session so that the current crop of radiologists who want to give FRCR will benefit from it. So first we will look at the basics of FRCR based on these 6 questions, like what is FRCR, who can give it, when is the ideal time to give it, then why to give FRCR, what are the advantages of giving the exam, where can you give it, and most importantly, how to give FRCR and how to crack it in first attempt. We will look at all of these questions, and if you have any queries, you can keep posting them in the live chat, and we will look at it later after we finish the talk in around 40 minutes. Coming to what is FRCR, it stands for Fellowship of the Royal College of Radiologists. It is the postgraduate degree of UK, like we have MD and DNB in India. It is the equivalent postgraduate degree of UK. It is an examination in 3 parts. There is a part 1 and a final part 2A and 2B. It is said to be among the 3 toughest exams hosted by the Royal Colleges of Medicine, which are radiology, pathology, and anesthesia. Mainly because the radiology exam is extremely vast. You need to know not just about everything about imaging, but also stuff like physics. You need to be thorough in anatomy, and you also need to know about the clinical implications of what you are reporting. So it's quite a tough exam. This is the logo, or also known as the coat of arms of the Royal College of Radiology. If you have seen Harry Potter, then it's similar to the Hogwarts coat of arms. Like many things in UK have a coat of arms, and below it is written Ex Radis Salutas, which means from race to health. So using radiation to bring about the welfare of mankind. So why to give FRCR? The most important reason is either if you want to become a permanent consultant in the UK, or if you want to apply for a fellowship in the UK. These are the 2 most important reasons. FRCR is quite a high quality exam, so the questions are of a very high standard, and some people, they want to give FRCR to see if they are themselves equivalent to the UK or international standards of radiology. So that's one reason. Again, working and doing fellowship in Singapore or Hong Kong is a reason to do FRCR, because FRCR is also the primary postgraduate degree there in these countries. If you want to work in Gulf countries, you can do that without FRCR, but of course having FRCR gets you a better job with a higher pay package. If you want to stay in India, it of course adds to your CV. And this I've picked from the Radiogan blog by Amar Udare sir and Dr. Inthulin. FRCR is a very is an exam with very high standards, and when you prepare for the exam for all three parts, and when you give it, your knowledge and your reporting skills are definitely going to improve. The main purpose of FRCR is to ensure that they produce safe radiologists who do not make any gross errors and who do not harm the patient. So when you prepare for the exam and when you give it, those things will get inculcated into your day-to-day practice, and that will help improve your own reporting. Uh, FRCR does not have much relevance if you want to do a government job or if you want to open your own diagnostic center. But if you are applying for corporate hospitals and tertiary hospitals, then certainly it will add to your CV and help you in job interviews. Uh, so again, why FRCR compared to something like PLAB or USMLE? FRCR is a completely radiology based exam. So everything asked in it is based on what you learn in your 3 years of residency. Whereas PLAB and USMLE, you have to read all subjects. So my purpose of giving FRCR compared to MLE or something like PLAB was that I did not want to read subjects like biochem, pharmac, and PSM again. So here you can just focus on radiology and give the exam. Who can give FRCR? It is open for any person who is currently doing MD, DNB, or DMRD, or those who have passed these exams. Uh, Part 1 and Part 2A are open for anyone who is undergoing radiology training or those who have completed their radiology training. For Part 2A, earlier there was a requirement of that you should have at least 2 years of experience, but that is not there now. So even a first year resident in radiology, if they want to, they can appear for Part 2A. For Part 2B, which is the clinical part, with the Viva and the practical exam, for that you need at least 34 months of clinical training in radiology, and as a proof you need to show a signed letter from your HOD that you have completed 34 months. Where to give the exam? It is at present it is only in three countries: UK, Singapore, and Hong Kong. If you go to these exam centers, especially in Singapore and Hong Kong, you will see that 90% of the people there are Indians. So out of every 190 would be Indians, 7 would be Pakistanis, and the rest 3 would be the local Singaporean or Hong Kong people there. Still, despite that, they are not holding the exam in India. I think IRI has made a petition to the Royal College to start the exam. But for now, we have exam only in these three places: UK, Singapore, and Hong Kong. So when is the exam conducted? Due to COVID-19, a lot of the sessions this year got cancelled, and the exams now are being held only for UK candidates. For overseas candidates like us from India, the applications will start from Feb of next year, from 2021 onwards. Every year, Part 1 is held in March, June, and September. This is true for next year also, for 2021 also. So it is held 3 times a year. Part 2A is held in June and November. Sometimes it's held in December also. And Part 2B is usually held in March and October. Now there is a special Desi session or a special Indian session which was started by the Royal College from 2018 onwards. So I was the one of the candidates who went for this first special Indian session. This is because, like I said, for every 100 people who are giving the FRCR, around 90 of them are Indians. So there is a huge craze for FRCR among Indian radiologists, and there is a huge backlog of Indian radiologists who want to give Part 2B, who want to clear Part 2B. So for specifically for Indian radiologists, they started a special session from Jan 2018 onwards. Sorry, from Jan 2019 onwards. So that was the first one in 2019. Uh, the second one they held in Jan 2020, and there is no news yet of a similar session for Indian radiologists for to be being held in 2021. But let's hope they again restart that. So because earlier before this session was started, there was a waiting of at least 2 or 3 years uh, to be able to appear for the 2B exam. But after they have started this session, people are able to give all three parts within 1.5 to 2 years. So that has helped a lot of Indian radiologists. When is the ideal time to give? So if you are a resident right now and if you are planning for going to UK for a fellowship or consultancy, and you want to go after 2 years after your MD or DNB, then I would say it's better to start planning early, better to start planning during your residency itself. So part one, it's good if you give it in the third year of residency, if you time it so that you are able to complete your physics and anatomy before your final MD or DNB exam. The physics which you read for FRCL will definitely make the physics of your MD or DNB exam much easier. You don't have to read anything separately then for the MD exam. So ideal time, I would say you can aim to give it in third year. Part two, some people, part 2A, I mean, some people they give it in third year. So if you are confident, if you have read your clinical radiology thoroughly, then you can aim to give it in the second half of your final year of MD and DNB. But I would say that it's the best to give it immediately after you pass your MD and DNB. So in the first year, if you are doing a bond, for example, so in the first year after which you clear your MD or DNB, you have your knowledge is fresh. You have just read for the final exams, and that is the best time to attempt this exam. I would say part 2A, because it is an MCQ based exam with questions on clinical radiology from all organ systems. And the third part, which is the part 2B, I would say it's best to wait after you have some experience, at least 1 year after MD and DNB. Radiology training in India is only 3 years. It's not like that in UK or in Europe. It's there at least 4 or 5 years at least. So the radiologists there, they are much better trained when they appear for 2B. They also have much higher passing rates, the UK radiologists, compared to overseas candidates when it comes to FRCR 2B, because of their experience. So I would say that it's best if you wait for 1 year post MD and DNB before appearing for the 2B. You can give maximum 6 attempts for any exam for any of these parts. For the seventh attempt, you have to show a certificate from your training institute that you have undergone some additional training before you can appear for the seventh attempt. Coming to the most important part, how to crack FRCR. The first FRCR exam, part one, consists of physics and anatomy. The second part, which is the final FRCR exam, is divided into two: the part A and the part B. Part A is an MCQ based exam, which the Royal College calls as SBA, or single best answer. So out of 5 options, you have to mark the single best correct answer. Part 2B consists of rapid reporting, long cases, and viva. Among these, I have highlighted in red. The physics part and the rapid reporting part are said to be the killer ones. So they are the ones with the highest mortality, or the ones in which most of the candidates they fail the exam. So these are the toughest: physics and rapid reporting. Coming to FRCR part 1 in detail, for the physics, it's a paper and pencil based exam, so you can appear for it directly. There is no waiting list. Problem is with the anatomy. So as the anatomy exam is a workstation based exam, there is a ballot system for it. You have to apply for it. If you are lucky, you will get it the first time. I myself got it the second time. I have seen some people, they don't get it even after applying for 4 or 5 times. So that's just purely luck based. There is it's completely luck based. And so both these exams are held on separate days. The physics exam consists of 40 questions. There are 5 options per question, which have to be marked either true or false. You have to attempt all. So effectively, you have 200 questions, and the time you are given is 120 minutes or 2 hours, which comes to around 3 minutes per question if you consider it as a 40 question, and it comes down to 36 seconds per option. So you have 36 seconds to read the question, read the option, understand it, and mark the correct answer in the answer sheet. The questions are distributed as such that most of the questions, around 24 to 28 of them on an average, are based on radiography and x-rays. So this is the most important part, being thorough with x-rays and radiography. And on an average, there are 3 to 4 questions each from ultrasound, CT, MRI, and nuclear medicine. The most important component which I found from my own session, as well as talking to multiple people from different sessions, was that the Royal College, as we said, that they want to produce safe radiologists. So they give a lot of focus on radiation protection and safety for all modalities. You are 100% going to be asked questions on these. So 4 or 5 questions guaranteed in the exam out of your 40 will come on radiation protection and safety related to X-ray. One question definitely will come on the armor and IRR. They have recently updated it, I think, in 2017. So one question will definitely come on those UK regulations. One question is there on fluoroscopy safety, one on ultrasound safety, one on CT dosimetry, one on MRI safety, like the MRI zones and all that projectiles, and one on nuclear medicine safety. So the nuclear medicine topics, they are given well in FAR, and they are sufficient, and FAR is sufficient to cover them. So now more and more, as digital radiography is getting practiced in day-to-day life, so more questions are being asked on that, on digital radiography, and hardly any questions are being asked on film screen radiography. There was no question on film screen radiography in my own session, but I have seen one or two questions being asked in other sessions. Physics in radiology is vast, it is infinite. People do PhDs in physics, so you don't have to get too much carried away when reading it. You have to focus on what is clinically important in your day-to-day life, and questions are mainly asked on topics which basic topics which radiologists should know. So it is important to see the MCQ books, see which topics have been asked previously, and cover these key areas well, and to approach them strategically. Like we said, covering your basics is very important. The physics component of FRCR really tests your basic concepts. So if you feel that FAR's textbook of physics is quite short, then it's better to clear your concepts first from a book like Christensen or Bouchon, and then go to FAR for clearing your basic concepts. And you need to do lots of MCQ practice. So everything for FRCR, from physics, anatomy, part 2A to B, it's all about practicing as much as you can, and solving as many mock papers as you can. So FARS Physics for Medical Imaging, that's the gold standard textbook for the physics preparation. If you are finding it a little difficult, you can first read Christensen and Bouchon, these books, and then after your concepts are clear, you can jump on to FAR. For MRI, Govind Chavan's MRI Med is fair enough. That covers most of the questions. And for ultrasound and Doppler physics, you can refer to radiographics articles, or if you want, you can read RUMAC. And for the nuclear medicine component, FAR is sufficient. So divide time daily. You need to do MCQ practice daily, and also read FARs every day. So divide some time daily for both. I would say start solving MCQs. Keep a aim of solving 20 MCQs per day initially, then increase them to 50, then 100, then 150. And in the last week, you can just solve mock papers. Like you can solve 5 to 6 mock papers of 40 questions each. These are the books. This is the list of books, and the top two I found the most useful. The first is the Shahzad Ilyas Physics MCQs for Part 1 FRCR. It's a book which has its level is quite a little bit higher than the actual final exam. So if you are thorough with Ilyas, and if you are able to solve that level of questions well, you will do well in the final exam. Another good book is Grant Meyer's Get Through First FRCR. And if you have time, then you can move on to these three books. Of course, radiographics and YouTube are big resources. You can refer to them to clear your concepts. And as we said for the last week, keep the last week for solving mock papers, and time yourself. See if you are able to finish the papers, the 40 questions in time. During the exam, you have to bring your own HB pencil, sharpener, and eraser. What I did was I solved the paper once fast in 1 hour. I solved all the easy questions first. The next half hour, I solved the difficult questions. And the last half hour, I kept for rechecking the paper. You will be able to do this if you have done sufficient MCQ practice, if you are thorough, and if your concepts are clear. So it's possible to do that. I would say that you can aim for this. And of course, when you are using the eraser, you are allowed to use the eraser to rub out or make any corrections. But when you do that, make sure that you remove the mark completely. Otherwise, that question is considered as invalid, and you lose the mark. There is no limit to the number of true or false options for a question. All of them may be true and all of them may be false. And there is no negative marking. It's +1 for a correct answer, and you don't get any marks for a wrong answer. Coming to anatomy, It is an image-based exam held on an Apple Mac workstation. Using it is used on an OSCE-based software, and a single image is shown on which a single arrow is marked, and you have to answer a question related to it. Earlier, around 7-8 years back, a single image was shown with multiple arrows, but that is not the case now. If you see the practice books for anatomy, you will see that most of them are like that. So a single image with multiple arrows, but that was the old pattern. Now you will get around 100 images, 100 different images with a single arrow on each image. So you have to solve 100 images in 90 minutes. At So that comes down to around, you get around 54 seconds per image to see the image, and to make the diagnosis, or and then type the answer in the box. So you get 54 seconds for that. Before you start your preparation, it's always good to see the interface, the software interface which is there, and a mock exam on the RCR website. It's better if you familiarize yourself with that. Um, it's good to be strong in radiological anatomy, basically during your reporting. So, and you can do that if you report maximum cross-sectional CT, MRs, and X-rays in your day-to-day practice. So that's a good way to get better in anatomy. The gold standard book for this is the is Abrams Imaging Atlas of Human Anatomy. It covers around 90% of the questions, and you need around 80% marks to pass. So if you do Abrams, that's good enough. But I would also recommend doing some practice books. We will come to that later. One third of the questions in the exam are divided into cross-sectional radiographs and contrast studies. The paper is also divided such that it gives 25% weightage to neuro and head neck, 25% to cardiothoracic, abdomen, and MSK. Normal variants are a favorite of the anatomy exam, especially the variants which can be confused for pathology. So be sure to be thorough in your normal variants. There are many online resources for that. The Radiogan website also has a great list of all the normal variants. There will be no images with pathologies shown in the exam, and there is nothing on obstetric ultrasound or neonatal cranial ultrasound. So those things are not asked in the exam. These are the practice books. These are the common practice books which are there. You can aim to solve all of them. I think if you are preparing for 2 months or 3 months, you can easily complete all of these books, all 5 of these books. One mistake which people make is ignoring anatomy at the cost of physics. So don't do that. There are people are known to fail in anat as well. There is around 25% failure rate for anatomy. If every day, give if you are giving around 70% time for physics, for example, then give around 30% for anatomy, and work on your own weak areas. So everyone has some things which they find difficult, like MSK MRI may be difficult for some, or head neck anat may be difficult, the all the skull base foramina. So work on all your weak areas. So during the exam, it's good if during the first run or the first time, you solve all the easy images in around 30 seconds per image, which comes down to around 50 minutes. During the second run, you can then solve the difficult ones and recheck the exam for the last 40 minutes. And for a completely correct answer, you get +2. For a partially correct answer, we get +1, and an incorrect answer gives 0. There is no negative marking. Read the question well. Not all questions are in the pattern of name the structure. Some of the questions are like, which structure passes through this foramen, or at what age does this epiphysis fuse, like that. Never use short forms or abbreviations. So don't write SMA, write superior mesenteric artery, and never ever forget to write left or right. You will lose 1 mark if you do that. So instead of, for example, if you write Vidian canal, it's just 1 mark, but if you will get the full complete 2 marks only if you write the left Vidian canal. Cutoff percentage for passing varies for part 1 and part 2A. The average cutoff marks which you need to get to pass ANAT are 73 to 80%. That varies from session to session. For physics, it's average, you need to score around 74% marks to pass. So this is from the data from the RCR website from the last 5 years. So from 2015 onwards. And the failure rate as per the RCR website, it's 25% for ANAT, and around 35% for physics. So around every 1 out of 3 people who give physics will fail. Coming to part 2A, there was the old pattern with 6 modules of 6 different organ systems, uh, and all of them had to be passed separately. That was the old pattern before 2017, and it was very difficult then, as you had to be thorough in CBTS completely, and you had to pass, for example, cardiothoracic and vascular separately. You had to pass MSK separately, like that. But now, in the new pattern, which started from December of 2017 onwards, you get 2 papers on a single day, and all organ systems are combined in each paper. So both papers will have questions from all organ systems, and you have to pass both the papers together. You get a combined score of both of them, and you have to pass them together. An advantage of this is that you can compensate for weak areas. For example, if someone is weak in cardiac MRI but good in neuro and abdo, then it is possible to compensate for this and pass. Earlier that was not possible. You have to pass all the organ systems separately. It consists of 2 papers on a single day of MCQs, which the RTR calls as SBAs or single based answers. There is a one correct option out of 5 which you have to mark. There are 120 questions in one paper for a total of 240, and you get 3 hours for each paper. So the complete exam is for around 6 hours, and the marks of both papers combined are considered when deciding whether the candidate has passed or failed. Never underestimate the difficulty of questions which are asked in 2A. It is generally thought that part 1 physics and the part 2B, these are the difficult components of FRCR, but still a lot of people, like around 40% people, they still fail part 2A. So it's important never to underestimate this exam. It is a mix of straightforward questions, but there are also a lot of tricky questions as well, which you will find out when you do MCQ practice from the practice books. And many of the questions are based on common dilemmas which radiologists face in their day-to-day life. For example, they will give a long clinical case of diabetic foot with the description, and you have to say whether it's Charcot's or osteomyelitis. So like we said, they give a long case, they give a long description of the case, they give all the clinical and imaging findings, and in the end they will ask a question: what is the most likely diagnosis, or which of these is least likely, or what will you do next, what is the next step in management. The easy way to approach these questions is, instead of wasting time reading the complete question, it's best to read the last line first. That gives you an idea of what they want to ask. Read the last line and the options first, and then start at the beginning and read all the case details. That way, I have found that you can solve the questions faster. It's important to crack to it. It's important to have good clinical knowledge of common diseases from each and every organ system. Also, along with that, you of course need to have knowledge of imaging, and you also need to have a basic idea of management of common diseases and how our reports they influence management of patients. People say that you can read Granger and Allison. I would say just stick to the charts, tables, figures of Granger if you want. Darnot is, it's not to be read as a textbook. It's good for reference. Some people read Branton Helms, and of course people read Osborne, Webb, Clyde Helms during their residency. So you can revise these books. But honestly, more than textbooks, I find that it's most useful to read journal articles like those from radiographics, IJRI, AJR, and others. So I found that reading journal articles is much more fruitful for 2A compared to reading textbooks. It's also important to do as much practice as possible. So that's the funda for every part of FRCR. Do as much practice as possible. It's important to cover all the topics which are there in MCQ books, because the questions which you are going to get in your exam are going to be from these topics themselves. So, for example, if there is a question on rectal MRI, for example, in an MCQ book, so I found that a similar question may be asked in the exam. So they maybe change the options, they change the clinical history a little bit, but the topics for the questions remain the same. So make sure that if you are, for example, weak in something like cardiac MR or cardiac CT, or maybe something in head neck, so it's better to read retrospectively, read these topics from journal articles well, and be thorough in them, because your most of the questions which are asked in the final exam, they are from repeat topics from the MCQ books. These are the commonly read MCQ books for 2A. I would say that the top three are the best. I would recommend everyone to uh, solve Lindsay, Proctor, and Curry. These three. If you have time, you can read the other three, but the top three ones they are must solve. And one thing about all these books is that they are old editions. I'm not aware if a recent new edition has come, but when I was giving this exam in December of 2017, at that time, all of these books were already around 8 to 10 years old. So they don't cover newer topics like cardiac MR, MR rectum, or multiparametric MRI prostate. Those topics, they are not covered in the books, but these topics are asked in the exam. So the newer ones, the recent, especially the MR related topics, it's good if you cover them from journal articles. Another important aspect of part 2A is that a lot of questions are asked on UK guidelines for healthcare, which are known as the NICE guidelines. And the common topics on which questions are asked in 2A based on the guidelines are on CT head trauma, NIA or non-accidental injury, coronary CT, IVU and MCU, then MRI for degenerative spine, and ovarian cyst management. There are also a few other topics you will come across these when you solve the MCQ books. So it's best to go online, not rely too much on the explanations which are given in the MCQ books. It's best to go online and check the NICE guidelines out yourself, and make notes of them, because 100% you are going to be asked questions on these guidelines in your exam. It's important to read all organ systems well, especially focus on your weak areas in the last 1 or 2 months before the exam. For passing, you need to score at least on an average 65% questions correct from every organ system for the exam. And of course, if you report maximum cases in your department on CT, MR, and X-ray, that will of course help in your preparation. During the exam, for the first run, try to solve the easy questions in the first 2 hours, and when you make the second run, so solve the difficult questions in the next half hour, and keep the last half hour for rechecking. So it's possible to do that if you have done sufficient MCQ practice. It's possible to do this, to solve the easy questions in 2 hours first, and then solve the difficult questions later. There is +1 for correct answer, 0 for wrong answer, and no negative marking. For 2A, the cutoff percentage again is variable. Since the new pattern has started in December of 2017, the average cutoff percentage for passing is around 61 to 64% marks. The failure rate as per the RCR website is 42 to 44%. So almost we are saying like 1 out of 2 people will fail. Earlier, the failure rate was even higher. It was around 50-60%, especially for things like the cardiac module. But now, since the new pattern, the failure rate has come down a little to 42 to 44%. Coming to the last part, the FRCR part 2B, to appear for that, you need to show proof of 34 months of training in clinical radiology. For DMRD candidates, you need to show 1 year of additional senior residency experience after you do your 2 years of DMRD. Day one is on rapid reporting and long cases, and the for both of these the answers have to be typed. And day two, which is around 1 to 5 days after the first day, day two is for Viva. The exam you can give at UK, Singapore, and Hong Kong. For UK, you need to apply online. There is a rolling list of candidates for the UK exam, and you have to wait for their email. So the RCR will email you, especially if you are lucky to be selected in the special Indian session in Jan. So you can expect to get an email by around mid-October, for at the start or mid of October. So that gives you around 2.5 to 3 months to prepare for the exam. You can also give 2B in Singapore and Hong Kong. Singapore is around 4 times costlier than UK. I'm talking about the exam fees. So the exam fees themselves, they are around 50 to 55,000 rupees for UK, but they are around 2.1 lakh rupees for Singapore. You also get an additional degree in Singapore, their M.Med degree, and it's on a first come first serve basis. So you need to have a very high broadband speed, and you need to sit there with all the documents at midnight. And so the ones who have the who click the fastest, they win and they get the seat in Singapore. And same for Hong Kong, it's around 5 times costlier than the UK exam. It's around 2.6 lakh rupees. That's just the exam fee. And in addition to that, you will be paying the flight tickets and for the hotel. Uh, it's also first come first serve like Singapore, and it depends on your internet speed whether you get it. So the first part which you will be solving, which you will be attending in part 2B is long cases. When you reach the exam center, you will be presented with 6 cases. For every case, you have to write 5 points. You have to type them. Observation, interpretation, your primary diagnosis, the DD or differential diagnosis, and management. So in observation, it's important to write the positive points and the important negative points. There is no need to do a vast extensive description with the relations and all relations. For example, if you are given a mass, then no need to describe all the relations of the mass, only describe the positive important findings. For interpretation, this is a bit tricky. You have to classify the case into a broad category like ischemia, infection, neoplasm, or trauma. You have to give then after that you have to give a principal diagnosis which you feel is the most likely, and after that you have to give a differential diagnosis and only the relevant ones. So give DD only if there is a differential diagnosis possible. For stuff like if you get a case of NF type 1, type 2, or von Hippel-Lindau or such neurocutaneous syndromes, so for them there is no DD. So there is no need to give a DD in such cases. So you can write that no other DD is feasible for this case. And then the last part is management. They expect you to write if there is an emergency finding on the case. It's expected that you write that you will urgently inform the referring doctor in case of any emergency. It's also important to write in most of the cases that I will do an MDT or multidisciplinary team meeting. You can find all these things, tips on how to write in the practice books for FRCR 2B, like what all things are expected to be written in the management part. You can also write whether you will do an ultrasound or CT guided biopsy. And for treatment, if you get something which can be treated using intervention radiology, it's great if you write that. For example, if you get a case of an aneurysm, so you can write coiling, stuff like that. So important to finish all 6 cases and don't leave any column blank. So you will be presented with columns for all these 5 things: observation, interpretation, and all. So don't leave any blank. There is no need to mention relation with adjacent structures for any mass or something unless they are relevant. For example, you need to mention a tumor thrombus. Then time is a very important factor, and so because you need to get into the habit of typing all the findings, and so you can do that if you practice typing your reports in your day-to-day life, so in your department. And it's difficult to fail in long cases. It's actually most of the people who attempt, if you have not left anything blank, then most of them will pass. But also at the same time, it's difficult to get more than 6.5 marks. So we'll come to the marking system later. So but it's difficult to fail, but also it's difficult to score high. No matter how well you do, you won't get more than 6.5 marks in long cases. Coming to the most critical part of which I feel of 2B exam, that's rapid reporting. This is the part with the highest mortality, where maximum people fail. The reason is that you are presented with 30 radiographs, and unlike Indian exams where we know that all of them are abnormal, here they may be normal as well as abnormal. So, and if they are abnormal, then you have to state what is the abnormality. To pass out of 30, you need to get at least 27 correct, which is why there is a lot of high mortality in this part 2B. So you need to have an accuracy of 90% to pass. Commonly asked things are like hairline fractures, pediatric fractures, pneumothorax, pneumoperitoneum, subtle hilar mass. These are the common things which are asked in the exam. There are a variable number of normals and abnormals. Around 12 to 16 may be normal for a session, and you may get around 14 to 18 abnormal, but it still varies. You may end up having 11 normals or 17 normals. And out of these 14 to 18 abnormals, 8 to 9 are obvious abnormals, which any MBBS student will also be able to answer. So they will be obvious fractures or obvious pneumothorax, something like that. but the others, the rest of them are subtle, and they are the ones which decide whether you pass or fail. Degenerative changes like in the spine or bones, they are to be labeled as normal. Normal variants, if you get, they are to be labeled as normal. Biggest mistake in the exam, according to me, is overcalling normals as abnormal. You can only remove this fault when you practice and do as much practice of rapid reporting sets as possible. Try to finish the exam a little bit early and keep the last 2 to 3 minutes for rechecking. It is also important to mention the side, like in ANAT, it's important to mention the side here also, left or right, otherwise you lose the mark. It's important to trace every cortex when looking for hairline fractures, and it's important to have a checklist of your review areas, which you will look for on every radiograph. Coming to the Viva part, there are four separate Vivas by four examiners, which are divided into two rooms. And almost any case on earth can be asked. They can ask anything from CT, MR, ultrasound as well, and X-ray. And the most important thing for clearing 2B is to do a mock Viva practice. You can catch your friends, colleagues, juniors, wife or husband, anyone, and you need to practice presenting cases to them. I would say at least for 2 months prior to the exam. During the Viva, there are two monitors. One monitor is for the examiner and one is for you, and there is a single shared mouse in between. Listen to the history carefully because that will always give you a clue at what the examiner is hinting at. And the as I said, there are two examiners in one room. So one examiner is sitting beside you in front of the monitor, and the examiner who is sitting behind, he or she is the one who is doing the marking and who is going to be marking. So it's important that you speak loudly and clearly because it's important that the examiner who is sitting behind you hears your answer well. Do not guess. Like if you are not sure, then say that you do not know and just move on to the next case. So that's the worst thing which you can do. Try to guess the answer. If you are not sure what the answer is, prepare a script, like what you will say if you want to move on to the next case, or if you want to get additional info from the examiners. You can either say I don't know, or in my routine practice I would ask for more history in this case, or if it was my routine practice I would ask for previous imaging. And sometimes the examiners then help you out, they tell you more history, or if you are lucky then you can actually get some previous imaging as well. uh, then it's always better to move on to the next case if you don't know the answer. And remember that the examiner will never mislead you. Like I don't know how it is in many Indian exams, but the UK examiners, they are actually very friendly and they are positive, and they are not there to fail you or mislead you. They are there to pass you. So any history which they give, or if they are pointing to some structure, they are trying to guide you in the right direction. And for any, if you get a case with any emergency findings, it's always important to say that I will pick up the phone and call. So just make a habit of saying this whenever you are presenting cases, and just imprint this on your mind. If you get an emergency case in UK, you are supposed to pick up the phone and call the referring physician or GP or whoever. So and they expect the same from you in the exam as well. So for any emergency case which you get, you have to say that you will call up the referring physician or surgeon and inform them the findings. For to be ideal preparation is 3 months, but if you get the Indian session in Jan, they email you around 2.5 months in advance, so you will get only about that much time. For the last 20 days before the exam, try to keep your work to a minimum, or it's best if you can get a complete off from your work. That's the best. Ideal routine per day would be to solve 3 to 4 rapid reporting sets in one day, not more or not less. So solving less than 3 would be very less, and solving more than 4 will lead to fatigue. So you can try it for yourself. If you solve more than 5 or 6 rapid reporting sets per day, that is very saturating. And so to keep a good balance, the optimum number is doing 3 to 4 RR sets per day. You can solve 6 long cases every day, 6 to 7, and it's good to do a one mock Viva session with your friends or colleagues every day. For rapid reporting, before you start solving the online case packets, it's important to read this book, Accident and Emergency or Survival Guide. by Nigel Rabi. So that's a very useful book for part 2B. Uh, Another book which is useful is Get Through Rapid Reporting by Nisha Sharma. When you are reading these books, when you are solving the rapid reporting sets, it's important that you prepare your own checklist for every radiograph. You can also get basic checklists online. They are available on the Radiogan website as well, and on some other FRCR related website. So you can get them. Keep these checklists with you. You can print them out. You can paste them on walls of your room, or you can keep them in your mobile to read while you are traveling. It's important to have checklists for each and every radiograph which can be asked. So there will be a separate checklist for a foot radiograph, a separate one for an ankle, another for knee, like that. So you need to have separate checklists for every single radiograph, which which will consist of all the review areas or all the gray areas which you are missing. It's important to practice, and do more practice. That's the only way you are going to pass in rapid reporting. And so it's useful if you make a list of things which you are getting wrong when you are solving these rapid reporting sets. So make a list of them, the things which you get wrong, and add them to your checklist. And that's the only way to improve for rapid reporting. Look at all possible fractures when you are preparing for 2B. So just open Google Images, and for example, just put in pisiform fracture, calcaneum fracture, hamate fracture. So look at fractures of all the bones in the body, in the appendicular skeleton. They even ask skull fractures. So skull radiographs are not something which we do in India. So those are things which are new to us. So they also ask skull fractures on radiographs. So make sure you see images of them also on Google Images. For rapid reporting, it is must to solve a few online rapid reporting sets. The ones on FRCR tutorials are free. They are a bit difficult. They are, I think, I would say they are much too difficult compared to the actual exam, but it's good that they are free. And the two best ones which I would recommend are FRCR Scholar and FRCR Academy. So you can Google them, and the fees around is, I think, 3.5 to 4,000 for each of them, for FRCS Scholar and Academy. But I would say that they are must solve. It's great if you are able to solve all of the sets in these three websites. For long cases and Viva, a lot of books are available. Out of them, Rapid Review by Shahid Hussain, I would say, is a must read. Rest of the books, this list you can get on any website at Radio Gyan, or you can get on Cafe Ranjan. Coming to courses, whether one should attend a course for 2B or not. For I myself attended a single course in Mumbai. I did not attend any course in UK or Singapore or elsewhere, but there are people who attended multiple courses in India, and according to them, the courses in Chennai, Bangalore, Hyderabad, they are much better. And people also attended courses in UK before the exam. So these courses are held around 1 week or 2 weeks before the actual 2B exam in UK. But I did not attend them. I attended only a single course in India, which was in Mumbai. It's good if you reach the exam country at least 3 to 4 days in advance. That helps you to overcome jet lag, and you can then set your body clock as per the exam timings. So if you are according to UK time, if you are going to solve rapid reporting at 4 o'clock in the evening, if your exam is going to be at 4 o'clock in the evening, then practice solving rapid reporting sets at 4 o'clock UK time every day for the one week prior to the exam. And focus on things which you are getting wrong, especially in the last week. And between the rapid reporting and the Viva, when preparing for the Viva, it's good if you present cases by video call to your friends or colleagues or family members back home. Again, do not underestimate the difficulty of this exam, and do not attempt if you have a very busy schedule ahead. So it needs at least 2.5 to 3 months of dedicated study to clear the exam. So don't attempt if you have a wedding coming up or something like that. So just it's always good to postpone the exam. Um, During the exam, of course, you should never argue with the examiner. Do not criticize the quality of the films, like suboptimal film or something like that. And it's good if you keep the post exam vacation planning to a minimum. Let your wife or husband handle that. Coming to the marking system of part 2B, we will see why it is very critical that you pass in rapid reporting. So each component has 8 marks. 8 marks for rapid reporting, 8 for long cases, and 8 marks for each of the two vivas. So that comes to 32 marks. Cutoff for passing is 24 marks, which means that you need to score at least 6 marks in all of them. In long cases and in most of the vivas, you will hardly get 6 or 6.5 marks. You don't, no matter how well you do, you are not going to get more than 6 or 6.5 mostly in long cases and viva. So if you are getting less than 6 in rapid reporting, if for example if you are getting 5 or 5.5, then passing becomes very difficult. At the same time, if you get 30 out of 30 x-rays correct in rapid reporting, that gives you 8 marks there. Long cases, almost everyone gets 6 marks. So if you get 8 marks in rapid reporting, 6 marks in long cases, you are up to 14 marks already. So after that, you are left with only 10 marks to get. So even if you fail both the vivas and you get 5 marks each in both the vivas, then you can reach up to 24 marks. The failure rate for FRCR Part 2B is around 44% to 51%, as per the data from the last 5 years. So other important things, all these FRCR exams you have to give in a foreign country. So because of that, it's difficult that you have to go there and acclimatize yourself to foreign conditions. So it's always good to plan your travel in detail. Use Google Maps a lot. It's best if you pick a hotel which is near a metro or a train station, or if it's near the exam center. So it's good if you plan out your route completely from the start, from the hotel up to the exam center. Well, it's good if you plan out all this before you board the flight to reach the exam country. And it's of course always important to keep at least 8 hours of sleep before the exam. For any part, to summarize, 3 months of preparation is ideal. 2 months is good enough. And practice and more practice is the most important thing for clearing any FRCR part. Doing as much reporting in CT, MRI, and X-ray as is possible uh, is in your day-to-day life. If you do that, then that will definitely help you for the exam. Solve as many mock exams as possible. They are available in the books. They are available online. And also, last but not the least, plan your travel in detail in advance. It is always better to over plan things than under plan them. And small things like uh, picking a good hotel or accommodation which is near the exam venue, they can make a difference in passing and failing in critical things like in part 2B. Uh, Finally, to conclude, there are fantastic blogs available on the Radiogyan website, which is written by Amar Udare sir and Dr. Insulin. Be sure to go through with them. There are blogs also available on the Cafe Ranjan website on all three parts. So that's it. So thank you, and we can then now move on to the question answer session.
Thank you, Ameya. That was an amazing session. There is so many, like there's so much stuff which is already on online about the FRCR exam, but in your talk you gave so many practical tips that I don't think any of those books will mention. Like the smallest of tips, I was noting these down and I found that this nobody is going to tell, say for example, like carrying a pencil, being ready with all the documents, with on the day of the exam forms
Yes.
open up. And the one tip which I particularly liked was trying to solve a few cases for the FRCR 2B according to UK time. So that's something which I don't think any book will mention. So your talk was full of a lot of practical tips, and I'm sure that most of the viewers, we've had around more than 150 viewers, and all of them I'm sure have learned a very few a lot of practical tips which no books will mention. So there are a lot of questions in the chat. We'll try to answer them one by one. uh,
Yeah.
so the other thing, like overall, from what I learned while working with Insulin for the blog and after
Yeah.
attending your lecture, is that one thing the take-home point would be that the RCR wants you to be a safe radiologist. So that's
Yeah.
something which is slightly different in terms of the practice. The practice in UK differs from the practice in a lot of Middle Eastern and Asian countries like India, Pakistan, wherein most of the staff clinical interaction is not much, as in we don't need to call up clinicians every time, especially if you're working in a government setup. So that point, I realized after working here and even from your talks, I realized that that's very important to involve the clinician and talk about multidisciplinary groups.
Right. Yeah.
So let's answer questions from the viewers. So Zoya has asked that about the 34 months period, does it include the period of residency, or do you need to have 34 months after you've completed
No,
residency?
it includes the period of residency. So for
Okay.
MD and PNB, that's straightforward. It includes you will complete 34 months in residency itself. For DMRD, which is for 2 years, you need to do an SRship or senior residency additionally of 1 year after you finish the DMRD. So
Okay.
it's including the residency.
Okay. Someone had asked me before in one of our Telegram groups about DMRE. I'm not
Yeah,
sure, again, because that's not a very well recognized
right,
degree throughout India itself. So, do you
right,
have any idea about it, or it'd be best to
right.
talk to the RCR?
So it's the same. Like we are not sure whether DMRE candidates are eligible for FRCR. The best thing would be to just contact the Royal College yourself and get an answer from them whether your degree is applicable, like whether you can apply for RCR if you are a CPS candidate.
Mhm. And in terms of communication, just so that
Yeah,
our users can expect this,
yeah,
how is the communication with RCR? Like, are they good
yeah,
with their communications, or is it very
yeah.
vague? And is there a particular address, or just go to the website and go to contact, or is there a particular email that you should mail to?
Yeah, yeah. So you can contact them. If it's possible, I can share the email after the talk. There are
Sure.
people in within the Royal College who reply promptly. They will solve your queries quite well. Like I would say, within a week, you would mostly get a reply from them. So they are quite
Okay.
particular. Yeah.
And then are they accessible by phone?
I never tried calling them by phone, but if I had any queries, I would email them, and they would mostly get back in a week or so. So
Okay.
there are a few emails. I will share them after the talk.
Sounds good. And
Yeah,
yeah, these may sound very trivial queries, but as
yeah,
like I have given a few exams, I've been through a lot of paperwork. I'm sure most of us
yeah.
have. So I was just trying to make sure that the candidates are aware if there's a particular way in which they can get faster replies. So I think that
Mm-hmm.
helps. Uh, the other the other good point about your talk was I realized that you're someone who would like every exam, I believe, has a way like a way to pass the exam, and not a lot of people think about that. And say, for example, if you understand what the RCR is testing you for, then you
Yeah,
can hack your way into the exam. And I don't
right,
mean in any illegal way or any say not so appropriate way. It's just
yeah,
to understand how the exam works. So if you
right.
can just revise, what are the high yield, you've covered most of them in your talk, but just
Yeah,
for our viewers, if you can revise for each exam, what are the high yield areas which are ignored? And
right, right,
say, for example, if we somebody is short of time, so we
right,
can focus on those and just
right,
clear the exam, say
right, right,
in the first attempt, as we've
right, right,
discussed.
right. So to summarize, the most important areas I would say for physics would be the radiation protection and the safety part for all modalities. So you are going to 100% you are going to get questions on safety for all modalities. For MR safety, CT dosimetry, ultrasound safety like mechanical index, thermal index, and nuclear med safety as well. And of course, things like the radiation units and those things. So radiation protection and safety in radiology overall is very important because they want to create radiologists who are overall safe in their practice. And you are going to get asked around 11 questions, I would say 10 or 11 questions out of the 40 related to safety of all modalities. So that's almost one fourth of the paper. So it's important to cover those things. For ANAT, I would say just focus on your gray areas. if you are weak in MSK, MRI, then focus on that, or you can focus on cardiac, or some people find head neck difficult, like head neck foramina, neck spaces. So just focus on your gray areas. For the part 2A, I would say it's important to be thorough in the UK and NICE guidelines, because you are definitely going to get quite a lot of questions on them. So it's important to go through them online, and go through the latest versions online. And if you want, you can make notes of them to revise at the last moment. So it's important to go through them. And for part 2B, I would say, uh, for the rapid reporting, it's important to have a checklist handy. You can keep it in your phone, you can keep it with you as in a printed form, but it's important to have checklists for all the radiographs handy, and to revise them every single day. So you need to revise them every day, and you need to make a habit of going through every radiograph according to the checklist. So I would say for 2B, for RR, that's the most important, having a good checklist. And for the Viva Viva part, I would say the most important thing is doing practice. So the more you practice presenting cases in front of your colleagues and friends, the better you will become. Yeah.
So I think those are you've summed them. You've already spoken about them in your talk, but you've summed them up really well. Next question is by Dr. Prabhakaran. So he mentions that his question is, how long will it take approximately for him to go to UK? Like his question, he doesn't want he doesn't want the specifics, but he wants the overall duration. But I would like to split this question. So because everybody, like currently there are multiple like students from multiple countries who would want to take the FRCR exam for various reasons. So there's a lot of delay in because there are so many people in getting your date for each of the exams. So in terms of say issues with getting the seat, and
Right.
like how much time should one expect approximately? I know because some of them are ballot systems, so it can be difficult, but say for
Right.
each exam, how
Yeah.
much waiting can one expect? And
Right.
according to you, how much time for
Okay.
each exam, say part 1, part 2, and part 2B, how much should we dedicate?
Right. Right. So if you are lucky to get through all the ballots in the first attempt, so if you are selected for every single ballot, you can expect to go to UK in 1.5 to 2 years. Like you can expect to clear all the exams in 1.5 to 2 years, because most of them are spaced 6 months to 1 year apart. So you will need at least that much time. A shorter route which some people take is to give plab. So if you want to go there very early, if you want to don't want to wait for 2 years at least to clear all the steps of FRCR, then you can give plab, which has a shorter waiting list, and you can clear it in a shorter time and go to UK. And for preparing for the exams, I would say that 3 months, 2.5 to 3 months is ideal for every step. So you get sufficient times between the two parts. You get sufficient time between all the parts to like prepare for them.
Okay. I think
Yeah.
that that would answer his question. So overall, if everything works out well, according to you, so 1.5 to 2
Yeah.
years, if you're
Yes.
like very
Yeah.
lucky, that would be a
Right.
good ballpark figure. And
Right.
otherwise, it's variable.
It's variable. Yeah.
Okay. The next question is very generic. I'm not sure if it'll be like feasible to answer that, but if you can quickly cover that. Mayank asks how to apply for FRCR. I know it's a very
Okay.
say a very basic question, but
Yeah.
there we have students who are maybe from first year. So if you can
Right.
just quickly cover that, it'd be
Yeah.
nice.
There is a, you can just type Royal College of Radiology or RCR in Google, and go in the exam section, and there you will get all the details and all the links for how to apply. You need to create a login ID, a login ID for yourself, and you need to keep watching the dates like we covered at the start of the talk. The part 1 happens in March, June, and September. Part 2 happens in June and November or December. So you need to apply for this in 2 months in advance. So the application process starts around 2 or 3 months before the actual exam. So if you are planning to give them in 2021, for example June, then you need to be aware of them, of the application process from around March, I would say, of next year. So you need to keep a watch on the website at that time. Yeah. So yeah.
Another practical question. So for these exams, for the application fee, do you need to have credit cards or Indian local debit cards would work? Because again, it's very like a basic question, but because you said the window is very narrow, it's better to be always prepared.
Yeah. So the window is narrow only for Singapore and Hong Kong. For for there it's first come first serve. For UK you have around a month to apply for the exam. So the window is not narrow for that. But for them, when I applied around 2 3 years back for each of these parts, you need a credit card with which is applicable internationally. So you need an international credit card to apply for this. But and also for Singapore and Hong Kong, you need international credit cards. So the local Indian debit cards they don't work.
So it would be a good idea to
Yeah,
get a
to keep on
credit
handy.
card. Yeah. So,
Yeah,
and anyways, it's like there are a lot of misconceptions about that, but credit cards
yeah,
are relatively safe, and most international like most countries elsewhere,
mm,
prefer credit cards over
yeah,
debit cards. We can discuss that in another session, but I agree that it would be a good idea to get a credit card.
yeah,
So Dr. Hina Khan requests the link for all the books. I've shared the link to the FRCR blog. I'll update it with the books which Ameya has mentioned. Most of them are there in the blog, but if
yeah.
there is anything that is missing, I will update that there.
Mm-hmm.
Uh, so everybody has been appreciating this session. Uh, so again, a very general question. So Nikhil asks, what would be the total expenditure? I saw that you did cover it, but if there
Yeah.
was a ballpark figure, say
Okay.
for like if you cover all three steps in the first attempt, so
Okay, sir.
what expenditure should be one looking at?
Right. So there is a fantastic table given on the Radiogram website, which in the blog written by Amar sir and Dr. Insulin. So it covers all the expenditure in a table format. So you can look at it there. That around you can expect if you are giving 2B in UK, like we said, it's around 50 to 55K. If for part 2A, it's something like around 40K. For I'm talking only about the exam fees. There is additional expenditure for the flights, of course, and for the hotels, which is variable. Like it depends. You can, if you are going to Singapore, you can live in rooms or dormitories which are around 700 rupees per night. If you are going with your wife, or and if you want to stay in a good hotel like 4 or 5 star hotel, then the cost would increase subsequently. And so for part 2B, it's around 55K. For part 2A, around 40 to 45K, I think, the exam fee. And for part 1, I think it was around, yeah, 40 to 50 in the same range.
Mhm.
So, yeah, and this is excluding all the expenditure which you have to do for flights and accommodation and all those things.
Mhm.
Yeah,
So, coming out of the same, on the same point, I know it's not related to the theory part of the exam and all, but you should always. So, life is more about exams than like you need to enjoy life as well.
yeah.
So, is there a possibility where we can time, say, a trip along with the exam, or that would not be a good idea? Or did you do anything when you took your exams? Did you club it with a trip, or is that not a good idea? And if yes, what are some tips for that?
Yeah, you can always club it with a trip. So if you are going with a friend or if you are going with your wife or husband, so it's best to leave the vacation planning to them. If you are going alone, still you can of course give some time to roaming around. So I would always give 2 to 3 days extra for roaming UK or Singapore or Hong Kong or whatever. So you can of course plan for that, but I would say don't for 2B especially don't waste too much time in that for 2B.
Mhm.
For part 1 and part 2A, you can, of course, it's possible to plan it out well. For 2B, I would say that time is critical and all of us have a lot of busy schedules. So it's difficult to
Agreed.
get the required 3 to 4 hours per day out of the daily practice to prepare for 2B. But still, of course, yeah, even with 2B, you can plan vacation and you can extend for 2, 3, however many days you want after the
Mhm.
exam. Yeah.
Sounds good. Uh, Before we move on to the last few questions, for those who are new here, make sure that you subscribe because we keep on coming up with good quality radiology content. Like if you go back and see our videos, most of it is quality content which you'll not find it on other websites. And because myself, I make content which I would want to see. So make sure that you subscribe. And even for those who are right now watching it live, I see that we have around 120 people, and not all of you have liked the video. The more you like the video, the more it reaches out to other people. So that's the least you can do. So make sure that you hit the like button and subscribe button.
One thing I would like to add is that during our residency, when I was preparing, there was nothing like radiogan out there. So really hats off to Amar Udare sir for starting the website, and hats off to his passion and dedication for radiology. And I remember asking him once earlier, like his idea behind starting radiogan, and he said that the new radiologists and the residents who are coming now, they should not face the same difficulties which we faced during our time. So I would say just hats off to him for starting this initiative. And it's now I think past midnight now in Canada where he is right now. So it's past midnight there, and you can still see him enthusiastically conducting the session. So yeah. So thank
Thank
you.
you for your kind words, Ameya. And I think that's the philosophy that all of us, you, me, and even the Cafe Ranjan team, all of us, we've been, say, we are 3 or 4 batches apart, and all of us want all our residents to, because when we were doing our residency, there was nothing around, and because of that, a lot of us didn't appear for exams. And as you said, the goal about radiogram and whatever we do, and it's the same philosophy that all of us have, that all of
Yeah.
whatever problems we faced, we should make it
Yeah.
easy for the others should not face.
Yeah.
So thank you for the kind words, and even your philosophy is similar. So that's the reason which I asked you to do the session, because I knew that you would put your heart into it, and that's the difference between somebody who wants to do it from their heart, and somebody who would just present it. I saw that there was very little material in your slides, but there was so much content that basically it was a very high yield talk. So let's move on to the next questions. Dikshit Varma asks that after clearing part one, is there a time cutoff for other parts? And I would add to that, like, is there a total cutoff for like, do we have to cover all 3 exams in a particular time? And after
Yeah.
that, is there a particular time that we need to apply to the UK?
As far as I am aware, there is no time cutoff for any exam. I will have to check the recent rules. Like I'm not aware whether the COVID pandemic has changed anything.
Mhm.
Uh, so it's always good to go on the RCR website and check out the rules there under the exam section. But as far as I am aware, there was no time limit when I was giving it. So you can.
Mhm.
I have known people who have cleared Part 2B around 10 years after they have cleared 2A.
Mhm.
Yeah.
And for everyone watching this, most of the questions that we cover, especially the generic ones, Ameya has tried to give the answers which are aware and like he's aware of. But if you have a question which you are not sure about, it's always a good idea to email them, because rules change, and especially given the pandemic, there may be certain changes that we are not aware. So make sure that if you have a query which is essential or that is crucial, just make sure that you shoot out an email to them. And as Ameya mentioned, they are quite good with their email replies. Uh, Dr. Theepan, I'm not sure if I'm pronouncing the name right, asks, can we return to the previous question while going through questions on the computer? I'm not sure which
Like,
part he's talking about, but is
okay.
there a possibility of flagging a question for
No.
review later, or
No.
no?
Yes, yes. So for any exam, so for anatomy, or if you are attempting rapid reporting or long cases, so all of these are workstation based exams, and you can every time return to a previous question. There is also a system of flagging the question. You can flag the question there, and I would advise everyone to go to the RCR website and go through the software interface which is shown there on the website, and there you can practice all these things like cycling through the questions, marking them for review, and all those things.
Mhm. Okay, when we were talking about the FRCR 2B exam and the long case, I had a query there. Do you need to write full sentences for each, or you can just mention bulleted points, or is there like is there
Right.
clarity on that?
Right. Yeah. So bullet points are more than enough. So no need to write complete sentences when you are writing the long cases. So just bullet points, the important positive points in them, and also the few important negative points. So that much is enough. So no need to write
Got
the
it.
complete sentence.
Again, a similar question on those lines. Do they deduct marks for spelling mistakes? Like, for example, there are certain syndromes which I
Right.
often
Right.
get the spelling wrong. So,
Right.
is there a way? Do they cut marks for that?
Right. So the RCR rules, they mention that if for minor spelling mistakes they will ignore that and they will give the marks. So it's all for ANAT. I would say it's best if you write the correct spelling there, because for ANAT the RCR rules don't say anything like that. So for anatomy part, it's good if you write the correct spelling. But like if you get like you said spelling of a syndrome wrong, they consider that. So that's given on the RCR rules for 2B.
Perfect. Dr. Neelam Soni appreciates all our efforts, and she asks, according to you, which would be the best center to choose for the exam? And even Rajat has a similar question:
Yeah.
which country to write the written exam, London or Singapore? So quite a few people have that question.
For which for 2B or
So
you would say
Neelam
for
doesn't
any part?
mention a specific, like she doesn't mention
Yeah.
which exam, which part. Rajat mentions, he asks about the written to be exam.
So for 2B, I would say that UK is easier compared to Singapore and Hong Kong, based on people who have given exams at all these places. Passing is a bit difficult in Singapore and Hong Kong, and it's said to be a bit easier in UK. So, and also the exam fees are less in UK, much less, I would say. Like we have seen, the fees are 4 or 5 times higher in Singapore and Hong Kong. So you also save a lot of money. So I would say, and they have now also started a special Indian session for 2B. So I would say you can aim for the special Indian session, which is mostly held in Jan of every year. And I would say that it's best to give to be in UK for part 1 and 2A. It really doesn't matter which center you go to. It really
Makes
doesn't matter.
sense.
Maybe your wife wants to visit London or and then you can decide accordingly.
Yeah, that's a question which will have to be answered on an individual
Yeah,
basis.
yeah,
On those lines, most of us who have their medical education and radiology in English, I don't think
yeah,
they would be facing any issues with the accent.
right,
When you gave your exam, and from others, what we have heard, is there an
yeah,
issue with say the accent,
accent, yeah. Mhm,
like on either side? Like for example, if you were saying
mhm,
something the examiners were not able to understand, or and what happens in that case?
yeah. No, I myself did not face any issue with understanding the accent, and I guess because I passed the vivas, so mostly they were able to understand me. Um, and it's important that you speak loudly and clearly, because the examiner who is sitting behind you near the door, he's the one who is marking you, and he's the one who is doing the marking. So the examiner who is sitting beside you during the viva, he is only showing you the cases, but the marks are being given by the examiner who is sitting way behind you. So you need to speak loudly so that he can hear what you are saying. And I
Makes
don't think
sense.
it's too much of an issue, the accent.
Makes sense.
Yeah.
We have a question from Dr. Hidayat, and even somebody had asked me a similar question on the Telegram group. Is can somebody apply for FRCR before joining residency?
No, so for to apply for, like, why do you want to do that? Like, I don't know. Like, just enjoy. Like you have a lot the time which you have between the exam and joining residency. Just enjoy yourself. But it's not possible because you need to be actively in training. You need to
Got
have
it.
be actively in training in residency, yeah, to apply for the exam.
Got it. And can you just quickly revise what would be the ideal time for each exam? I know you did mention that, but just because we are on that topic, if you can
Yeah.
quickly mention what is the ideal time to give each exam?
The prep time, you mean, like
No,
or
no. As in, like, say, for example, during residency, which
yeah,
exam
yeah,
should we
right,
give,
right,
like in first year, second
right,
year, or after
right.
your residency?
Yeah. So in India, we are asked these questions on. We have a separate paper on physics in these MD and DNB exams. So it's good if you time the part one so that you read it in your third, you appear for it in your third year. So so by the time you appear for your MD and DNB exam, you are already thorough with your physics, and I find that it definitely helps in your MD and DNB exams. If you have given part one before you give those final MD DNB exams. So I would recommend giving them if possible in your third year of residency. Part 2A, some people they give it before the MD-DNB exam, but I would advise the best thing is to give them just after the exam. So if you have cleared the MD or DNB in June, then it's best to appear for the 2A in the December of the coming year, because all the knowledge which you have read will be fresh in your mind and the exam will be
Makes
that much
sense.
easier. Yeah, and 2B, I would say don't try to give it at least till you have 4 years of experience in radiology. So like 3 years of residency and 1 year of bond or something like that. So don't try to give it at least till you have 4 years of experience. So because that experience helps you, it's a practical based exam with vivas and cases. So that experience helps you in the exam.
Mhm. Uh, Rohit has asked if, since the anatomy is via ballot, should
Yeah.
we apply for anatomy first and wait until we
Yeah.
get a seat and then apply for physics?
No, it's you have to apply for physics and anat both together, because so if you see the RCR website, you can apply either for physics only, either for anat only, or for both physics and anat. So it's always makes sense to apply for physics and anat together, because physics you are anyway going to get, and anat ballot, if you are lucky, you can be given a call later. Like if someone from UK cancels giving the exam, then you can get their seat in UK. So things like that also happen. So always prefer the physics plus anat option.
Makes sense.
Yeah.
Another question, like there are a few questions by from Dikshit and Rajat about post FRCR. We're planning to have a separate blog on that.
Right.
Dr. Sohail Abdullah asks if there is a single textbook for general radiology that every resident should read so that can help with the FRCR preparation.
Right. Most of the questions they are from Granger. Many of the questions I would say for 2A, and many of the concepts which are asked in 2B, they are there from Granger. But I would still say that the most useful things are the MCQ books themselves and the journal and reading journal articles like from Radiographics and IJRI or AJR. So they are the most high yield, I would say. For physics, the most important book is FARS, from which I think it covers most of the questions which are asked in the exam. So you need to do at least 2 to 3 readings of FARS.
Sounds good. Uh, Again, there are a few questions about after FRCR. We'll try to cover that separately. Uh, let's see. Ameya, are you aware about the PLAB route, or I'm not sure because I am not aware about that. Are you sure about, like, are you aware? Did you find out about it? Because there are a couple of questions. So Preeti asks, how does PLAB help in radiology? And I saw another question regarding the PLAB route.
Yeah, yeah. So there are two ways to do practice in UK. Either you can go via the FRCR route or you can go via PLAB. So the PLAB route is shorter, and I'm not aware of the details of how to apply for it and all. But there is a nice blog on the Cafe Ranjan website on this, on like how
Sure.
to get into UK through PLAB. So maybe people can read that.
Yeah, because I think that will answer most of their questions.
Most of the, yeah.
So someone's asking if he's in the first year, can he start
Yeah.
applying only after finishing 1 year in radiology, or he can start right away?
No, they can start right away. So
Okay,
you can, if you are confident, you can apply for it in at the end of your first year itself. If you have read physics thoroughly, you can yeah, you can give it. Yeah, in your
sure.
first or second year also.
Yeah, Dr. Anwar again is asking about GMC registration and IELTS, but I think that is after FRCR, so we'll
Okay, yeah.
ignore that. A question from Samir Khan, again, is a very general question, is what is the purpose? I think you covered that in your start of your lecture, where you
Sure.
talked about what is the advantage of FRCR. So what you can do is,
Right.
Samir, just go back once the lecture is done, go back to the first few slides, and Ameya does talk about that. So
Yeah.
again, lab pathway, I'll keep a link to that. Okay, so Dr. Madhur, I think we answered that your question about you're talking that you're going to appear for your final exams in March 2021, so that'll be a good idea. So
Mhm.
Snehil mentions, are the chances of getting anatomy ballot more if we fill in the centers from UK as
Yeah.
compared to Singapore center?
Um, I would not say that. I think it's completely based on luck. And with the pandemic, there are a lot of people who are now in a backlog for ANAT and all these parts for 2B as well. If by chance, if a seat gets vacant in UK, and if you have not been allotted a seat in Singapore and Hong Kong, you would always get an email from the RCR that a seat has just now opened up in UK, and do you want to apply for that? So I don't think it makes a difference. Yeah.
Okay. Uh, Dr. Anwar has also asked, can I appear for FRCR for part 1 and 2A after completing 2 years of diagnostic radiology? Do I need to have GMC registration for appearing 1 and 2A exams?
GMC. No, GMC registration is something completely different. Like it's equivalent to something like we have MCI or MMC registration in India. That is something which is to be done after you clear FRCR. For applying for FRCR, you just need to be in training in radiology, or you need to have completed your training for part 1 and 2A. For part 2B, you need to show proof that you have worked for 34 months in a training center in radiology. But you don't need GMC for that.
Makes sense. Priyanshu asks whether he can give the exam in the first year. So as Ameya mentioned, that it's a good idea if you're prepared, if you think your
Right.
prep is good, that's a good idea.
Yeah.
One another question which I've got multiple times, Dr. Gorakhnath is asking if it is easy to radiologist who's completed 10 years back,
Mhm.
completed the radiology long back. Is it okay?
Right.
Like, is it easy or difficult to give? Again, it'll depend on a lot of factors, like where did you
Right.
do a radiology and how, what kind of practice you are. But if there
Exactly.
is anything that you would like to add to that.
Yeah, exactly. So I would say that the physics part may be difficult because it's easier for residents who have recently read physics. They are in touch with it, so it's easier for them to crack physics. But of course, you can do it. So if it's important to take out some time, like at least then you would need around 3 months of time of dedicated preparation to prepare for the physics part and then give the exam. The clinical part, the two-way, that should not be that difficult. And same for 2B, the long case and Viva also, since you have experience, it should not be that difficult. For rapid reporting, I think if you are not doing X-rays in your day-to-day reporting, if people are only doing, for example, Sono or CTMR, then I think then 3 months of preparation is required. Regardless of your experience, 3 months of preparation is good for rapid reporting.
Okay, I think we have already overshot our time and we've answered most of the questions. One last question which I had was I saw your preparation was very focused, and right now, I don't know if all of us face this issue, but as you said, we didn't have a lot of resources, but right now
Right,
residents have too many resources. So,
right.
is there any particular podcast or a particular YouTube
Mhm.
channel that you would recommend to help the preparation?
Yeah, so I myself for my 2B, the blog which is there on Radiogan, written by Dr. Inthulen and Amar Udare sir, that is fantastic. I think that covers almost everything. And similarly, on the Cafe Ranjan website, if you go, Dr. Chinmay Mehta has written a wonderful blog on how to clear 2B. So myself, I was helped by these two blogs a lot. So they really clear your concepts, and I would recommend them for everyone. And Radiogan, I think, is good for everything about MD, DNB,
Mhm.
like has spotters and all, everything. I think it has everything related to radiology under the sun. So I would recommend it for any new resident who is now, yeah, in radiology.
Sounds good.
Yeah,
There's a podcast called Songs for FRCR. We've mentioned that on our
right,
blog. I'm not sure how good it is, but because if like when you're traveling and you're not doing anything actively, you can just put on the headphones and listen to that blog. So I've linked that on my webpage, and I think it's time to stop. If you have any particular questions, Ameya has shared his email
right.
in the chat, and I'll request him to share it again so that for those who have any for the questions that we were not able to cover, either because of time or repetition, you can email him, and he'll be more than happy to help you with your questions. And with that, I'd like to thank Ameya once again for this amazing marathon session. We've completed almost 1.5 hours, and we've covered a lot of queries, and you've given a lot of practical tips to the residents, and I'm sure that most of the viewers would benefit a lot from this. So thank you, Ameya, once again.
Thank you, sir.
And again, for those who are not subscribed, make sure that you subscribe to the channel and hit the like button so that the video reaches more people. Thank you, and we'll see you in our next video.